Hello and welcome to The Agenda. I'm Stephen Cole. With the COVID-19 Omicron variant spreading rapidly, many countries are bringing back travel restrictions and considering new lockdowns, a big economic blow in the season of goodwill and spending. As EU Commission President Ursula von der Leyen has put it, the world is in a race against time. So this week, in an Agenda special, I'll be talking to the World Health Organization's Regional Director for Europe, Dr. HANS Kluge, to find out just what is needed to stay ahead of the curve. As countries began offering COVID-19 booster jabs, there was hope the worst might now be behind us. Then the new variant Omicron arrived, causing scientists to worry and governments to reopen the debate about mandatory vaccinations. As mounting numbers of cases and variants are detected, the World Health Organization continues to lead countries through the many unknowns. The man in charge of the European response is Dr. Hans Kluge, the World Health Organization's Regional Director for Europe, and he joins me now. Dr. Kluge, I'd like to start by discussing the Omicron variant. How much do we know about the variant and the fact that scientists are worried about it because it seems to have several mutations?
It's a bit early to say. For each new variant, there are 4 parameters which are important to know. The first one is the speed of transmission. The second one is the virulence, whether it attacks more severe. The third one, whether the variant escapes immunity derived from the vaccines and treatments we have. And the fourth one, whether the variant attacks different age groups to a different degree. The truth is, Steve, that today we know very few about this. But why are we concerned? Because as you're mentioning, this variant, Omicron, has a number of mutations we haven't seen before, and a number of mutations that could lead to a faster transmission, a higher risk of reinfection, but we need to keep the head cool because ultimately we are not in the business of fighting one variant. We are in the business of fighting all variants. The tools are the same, and let us recall that still our region in Europe and Central Asia is completely Delta dominant.
And is the WHO confident that the vaccines around at the moment will be sufficient against the new variants?
For the time being, we do not have any evidence of the contrary. Vaccines are safe, effective, they save lives. We just published a research together with the European Centre of Disease Control that thanks to the vaccines, 470,000 lives in our region have been saved between December 2020 and 1 year later, October 2021. And that's an underestimation because the survey was done in 33 out of 53 countries. So the people are to be encouraged to take their vaccines and a booster, but on top of that one, also adhere to the classical preventive measures.
Different countries, Dr. Kluge, in Europe have taken different approaches to vaccines and towards the variants. Who's getting it right, do you think?
The lack of policy coherence has been and still is a big challenge. It confuses people and is not effective. It's too early to say who is the best pupil and who not, because there's so many examples that success today does not mean success tomorrow. We're still in the midst of the pandemic. Europe, unfortunately, is again the epicenter of the pandemic. Every country has been doing good things. Other countries have been doing similar, but a little bit better, a little bit worse in some aspects. The key issue is that the only way to get out of the acute phase of the pandemic is if the politicians, the scientists, and the people pull in the same directions. If politicians are making decisions based on populism and not on science, that's in particularly where we see an increase of the cases.
Infection numbers had been fairly stable, hadn't they, since the summer, but the colder weather has seen a sharp rise across Europe, even before, that is, the introduction or the discovery of the Omicron variant. Wasn't that always likely? And could you at the WHO have done more to prevent it?
So there are three main reasons why we are in this situation. Number one, what we call seasonality. With the winter coming, people automatically are gathering more and more in closed, crowded settings. Number one. Number two, still a huge part of the population is sensitive, susceptible to the infection, either because they're not vaccinated. For example, the children, we see that the age group which has an incidence 2 to 3 times higher than the general population are the children between 5 and 14 years. But also because there is a waning of the immunity once the people got the vaccine. Basically, if you got vaccinated 6 months or longer ago, you may consider yourself unvaccinated. And that's why the booster is so important. And the third reason is that our region is Delta dominant, which is a variant which transmits much faster. Now, on the WHO, I can assure you that we are in constant contact with each of the 53 countries, but a number of decisions are national competency. And that's why it's so important that we are convening to boost that policy coherence. For example, on the COVID-19 certificate, because if depending on the vaccine that people got, you can more easy or more difficult or not at all travel, this creates confusion and ultimately geopolitical tensions.
I wonder if there's a wealth gap in the approach to vaccinations. Some of the poorer countries are definitely falling behind with the number of vaccinations. Is that why variants keep emerging and why the richer countries will keep needing booster shots?
Well, first, the booster shot, stricto sensu, is not a booster shot. It's basically, it becomes part of an essential vaccination scheme. So everyone needs 3 doses in whatever country you're living, because the immunity derived from the vaccine is waning, particularly after 6 months. On the inequity, this is the huge, huge issue. I mean, I see it in my region, where 67% of the richer countries have the population fully vaccinated, down to about 24% in the lower income countries. But then if you look globally to the African region, Southeast Asian region, the challenge is much more bigger. The mantra is straightforward. The more transmission, the more variants. And it's why it's in the interest of richer countries like the G7, like the G20, to take a much bolder action, because they will not be safe until the rest of the world is safe. No one is safe until everyone is safe, and I have seen it with Omicron.
In the case of Austria, compulsory vaccinations will be introduced as from February, I think, 2022. Do you support compulsory vaccinations?
Compulsory vaccinations, in any case, should be what I call a measure of last resort. We have experienced that compulsory vaccinations increase public distrust, increase anti-vax feelings and social exclusion. So the first priority is to ensure that vaccination is easy. Make vaccination easy. You were just mentioning a couple of minutes ago, rightly so, that there is still too much vaccine inequity. So if a country decides to go for mandatory vaccination, number one, there has to be a very clear, detailed implementation plan, including exemptions, provisions for people who, for some reasons, cannot take the vaccine, and a very clear communication strategy. That's key above all.
A clear communication strategy. Well, what about a clear, uniform vaccination strategy across Europe?
Not only across Europe, I would say, but globally. So that's why I established a year ago the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, chaired by Professor Mario Monti, previous Prime Minister of Italy. And one of the recommendations is on a new form of multilateralism. Already at the G20, the main recommendation was implemented, a G20 Health and Finance Task Force, because the G20 has to take the responsibility. Ultimately, if we have 15 to 16 billion of doses, we can kill off the pandemic. So why it is not happening? And the same at the European level, there the recommendation, with France going to have the EU presidency, is the need for a pan-European Health Security Council. It's ultimately the heads of state, also at the UN General Assembly, who have to take the bold leadership for a global vaccination strategy, because we cannot continue like this.
I mean, that is a wonderful idea, a global vaccination strategy. It's not going to happen because you won't get agreement globally. Has the European Union done enough, do you think, to introduce a uniform vaccination strategy in the 53 countries?
Well, first and foremost, the European Union covers 27 of the 50 countries for I'm responsible, but they have been tremendously helping, for example, the Balkan, Eastern Europe, and I'm very, very appreciative. I think a silver lining, if you speak about the European Union, is definitely the joint procurement of vaccines. And that smaller countries are telling that if there would not have been a joint procurement, that those smaller countries definitely would have missed the boat. But the European Union made an agreement with the administration of the United States of America, Transatlantic Partnership, to boost technology transfer, to establish and support a mRNA vaccine hub in South Africa. I had discussions with the chief scientist of WHO Geneva only one day ago on looking at countries in the region here for such a hubs. So I believe it's coming, but it goes too slow because speed is our best friend.
Yes. Well, of course it is.
Speed is the best friend.
With the variants arriving, we do need speed of action. I mean, Austria is talking about compulsory vaccinations. In Germany, they're talking about vaccine passports. Would that be a good way to go?
Well, vaccine passports, definitely. I always have been telling vaccine passports or passes should not be seen as taking liberty away. It's a collective tool to keep our individual liberty. I think we have to remind the people what happened a year ago. I mean, a year ago, the world economy came to a standstill because, frankly speaking, the lockdown was a shutdown with a tremendous toll on mental health, particularly our youth, the biggest disruption in history of education. So we need really to make use of such instruments as the COVID-19 passports and passes to avoid a similar scenario. And there it's important that people do not get impoverished due to very expensive testing, because in some countries the testing becomes very expensive.
It's time now for individual rights to take second place to public safety, doesn't it?
If we speak about mandatory vaccination, Steve, let's remember what the vaccines are doing and not doing, because there's a lot of misunderstanding. The vaccines are not interrupting transmission. The vaccines are preventing severe disease. They are preventing deaths, and by doing so, preventing the hospitals to collapse, which is terribly important because the hospitals have to pick up with other diseases than COVID-19. But vaccines is not going to lift us out of the pandemic. We need vaccination plus approach. 5 pandemic stabilizers. Number 1, vaccination, coverage goes up. Number 2, booster. Number 3, masks. I mean, only 48% of the people in the region are wearing masks. We know that 52% the incidence is cut with a mask, cheap, effective. Number 4, ventilation. We don't speak enough about ventilation, particularly in schools. We have to do everything possible to keep the schools open. And number 5, our new treatment protocol. So vaccines is top priority and the booster, but it's not going to lift us out of the pandemic, like we see, for example, in the United Kingdom.
And that's despite the UK's new booster campaign. Well, Dr. Kluge, thank you for the moment, because we're going to take a pause. Still to come, though, here on the agenda, we'll be talking about the role of masks, staying safe this Christmas, and the indirect costs of COVID. Mari, what would you say is a good question?
Stephen, I'd say it's one where there's always more than one answer.
The Answers Project is a new podcast series from CGTN Europe. With me, Stephen Cole.
And me, Mari Beveridge. In each episode, we'll take a complex question.
And with the help of some of the world's foremost experts, shine light on some of the answers. So join us for The Answers Project.
Available wherever you get your podcasts.
Welcome back to The Agenda with me, Stephen Cole. And I'm talking to Dr. Hans Kluge, the World Health Organization's Regional Director for Europe. Dr. Kluge, what's your message to Europeans about wearing masks?
On the masks, it is one of the 5 pandemic stabilizers. Increase vaccination coverage, booster, masks, ventilation, new treatment protocols. So the masks, particularly indoor, crowded places where we cannot guarantee 1.5 meters physical distancing, are an essential tool. I always have it with me, and I call...
Yes, you have a mask with you, Dr. Kluge, because you're a sensible and intelligent man and you know the risks. There are many people on the streets and in shops and on the underground, certainly here in London, it's probably the same in Berlin and Paris and elsewhere, who don't wear masks. How can you persuade them of the efficacy and the safety of wearing masks?
A number of points here is that people are tired to listen to politicians and to experts. So one of our approaches now with the countries is to work through influencers. I just came back from Greece with the very charming, famous former gold Olympic champion Sofia in sailing. We made a video clip to encourage the people. So we have, again, with our behavioral scientists, see to who do the people listen, to who do the young people listen, to who do the elderly people listen. In Greece, it are the people 60 years and above where there's a challenge. So we need to look who are the influencers and get them on board with good, strong risk communication.
A great idea. Of course, all of Europe is about to celebrate Christmas. Should we be celebrating Christmas with friends and family?
We should absolutely celebrate Christmas, but celebrate safely. In your bubble, take the self-test if you go somewhere, and be your own risk manager. We have to respond like the people. The people are not the problem. The people are the solution. And of course, the political leaders have to give the example. If the political leaders are not following the WHO recommendations, well, then, of course, this is absolutely a catastrophe.
The pandemic has put a huge strain on the world. You mentioned economically, but there's a lot of strain for individuals about anxiety and mental health, domestic violence. How do you see your role as the WHO in Europe in helping people survive this kind of anxiety and violence, and quite a lot of isolation as well, putting huge pressures on people?
We are very concerned. This was one of my flagship initiatives when I became the region director. Before the COVID-19 pandemic, already 12% of the European population was suffering from mental health issues, about 110 million people. Now we know 1 out of 5 healthcare workers, 1 out of 2 young people, anxiety, depression. I see the influence, the impact of the COVID-19 also on my own daughters. This is very, very clear. So the Pan-European coalition is now translating into national coalitions where we are working country by country to raise, number one, the mental health at the top of the national political agenda, put it in the heart of the economic recovery. And there we have a very good understanding with the European Commission, which is fully on board, and I'm very appreciative. We need to decrease stigma and discrimination. and then increase the investments to bring mental health closer to the people. I call it bring mental health out of the shadows. People have to talk about mental health. People have to talk about their own burnouts. People, famous people, to talk about. There's nothing shameful about it. But now top priority is to take care of the mental health of our healthcare workers, because we're going through a very tough winter now. And for example, very concrete actions, make sure in every medical facility there is a focal point for the mental health.
You say you have concerns about the mental health issue raised by COVID, but there is a physical health issue as well, isn't it? Many other symptoms and many other problems, healthcare problems, like cancer, are not being treated or not being diagnosed in time because people aren't being able to get to see their GPs, their doctors, or go into hospitals. So how can the WHO help with people who have these terrible ailments but can't get into hospitals and can't see their doctors?
We have issued very concrete guidance on that one. We call it dual track health system approach. So the COVID-19, obviously, but to pick up really with all the other diseases. Cancer is indeed an example which is spot on. We're very concerned of a cancer pandemic. We know that in a majority of the countries, the screening services have been disrupted. We put together a special program, United Action Against Cancer, but also cardiovascular diseases. In fact, 9 out of 10 people in our region are still dying from what we call non-communicable diseases, chronic diseases, respiratory, heart failure, stroke. So the best way to protect our hospitals and primary healthcare physicians is for the people to get vaccinated so that they don't end up and overwhelm the intensive care unit. So it comes back to the basic vaccination plus approach. Get the vaccine, get the booster, wear the masks, ventilate crowded indoor places, and have up-to-date treatment protocols.
One day, we both hope this pandemic will be over. And you've talked in the past about a global recovery leading to a different economy, a well-being economy. What exactly do you mean by that?
What we mean is that we are putting health and well-being in the heart of the society. This was nothing new for me, for health people, but for many heads of state and even many people is new, that when there is a breakdown of health, there's a breakdown in societal cohesion, in economic development, and ultimately, as we see with the inequity in vaccines, also in global security. That's exactly why I established the Monti Commission, the Pan-European Commission on Health and Sustainable Development, to rethink policy priorities in the light of the pandemic. How are we getting on track towards the sustainable development goals, towards better health and well-being and quality of life? Because the big burden, disease burden, is non-communicable diseases, chronic diseases. So many people will live with several diseases at the same time, of which they cannot be cured. But at least that the quality of life is there, and that has to be in what we call a green environment, because there's a lot of links between a healthy green city, green environment, and the mental health of the people, because we will have to live with the fallout on mental health far longer than the pandemic. So in that sense, it means put health and well-being of the people in the center and heal the fractures in society. If we cannot get to vaccine equity, the fractures in society, the geopolitical tensions globally will only increase.
Lastly, Dr. Kluge, what lessons are the WHO learning from the pandemic and how you've approached it, how you've treated it, how you've reacted to it? And do you think your lessons learned will lead to reforms in future? And if so, what sort of reforms are we talking about?
I would say, number one, that health is the entry point to a peaceful and prosperous society. For this, we need to invest in health systems. Several countries almost their whole health system collapsed because of chronic underinvestment, including in the health workforce, which was very stressed. For example, the nurses even before the pandemic. So invest in health systems and primary healthcare. Most of the diseases can be treated in primary healthcare, in community care, and let the hospitals do what they're supposed to do. Treat complicated cases. We have to nurture our health workforce, attract the young professionals. And then the second group of lessons learned is for WHO. For me, as a regional director, the diagnosis is crystal clear. We need three things. Number one, a much stronger role of the WHO regional offices. The World Health Organization is unique in the sense it has 6 semi-autonomous interlinked regions. The regional office is in a very good shape to pick up signals very early on, even before a pandemic is being declared, so there is no delay over there. Number two is sustainable, predictable financing of WHO. All the reviews showed that WHO is underpowered and underfinanced. And number three, we need a new global pandemic instrument, be it a revision of the international health regulations or a new treaty, which includes provisions. What happens if a member state does not adhere to the treaty? For example, if a country does not allow a WHO mission to independently verify the data, what's happening? Because WHO gets blamed for this, but WHO is not the World Health Inspectorate. We are only as strong as the teeth given by the member states. We are governed by the member states. So if the member states want us to have a stronger monitoring and inspected role, we'll be happy to do so, but this is the time for the member states to make up their mind.
Dr. Kluge, thank you very much indeed. I just hope we're not having this same conversation this time next year. But Dr. Hans Kluge, many thanks for joining us here on The Agenda.
My pleasure. Thank you.
Not long ago, critics were calling the UK Plague Island because of the high infection rates. Now, things look very different, and that's partly a result of Britain's early vaccine rollout. But as we've heard from Dr. Hans Kluge, success today doesn't mean success tomorrow. Europe, for example, is still at the epicenter of the pandemic, and Omicron's transmission speed could change everything. Europeans, I think, have been paying a high price for their government's vaccine handling. In Germany, where cases are at their highest ever level, Christmas markets have been cancelled and the unvaccinated face limits on their freedoms. Belgians must now work from home 4 days a week. The Netherlands, despite a high jab rate, became the first Western European country to impose a new partial lockdown since the summer. But perhaps the most draconian response has been in Austria, where vaccinations will be compulsory for adults as from February, and refuseniks will face fines or even jail. A drastic move. Despite 1 in 4 people over 12 now having had a third jab, this doesn't mean the UK can afford to relax completely. There are inevitably unknowns to consider as we look ahead, not least the fear that waning immunity levels could lead to a sharp rise in the number of deaths. Until the world finds a way out, vaccines, masks, space and ventilation remain part of our crucial COVID toolkit. For now, the chance to carve a pandemic-free future is in our hands. Don't forget you can watch everything from past Agenda episodes and find additional exclusive content on our website, cgtn.com/Europe, or on our YouTube channel. And of course, you can follow us on Twitter, Facebook, Instagram, @CGTN Europe. Coming up on a future agenda, we'll be looking back at the last 12 months of saving the planet as part of our Agenda Year in Review. But for now, from me, Stephen Cole, and all the Agenda team here in London, it's goodbye.